Hi, I'm Summer. This is Sam, and today we'll be discussing lobotomies.
Okay, the topics we're going to be discussing is how it affects different age groups, which will be children, teens, adults, and their life post-lobotomy, an explanation of the procedures, how people assess post-lobotomy, which is the infantile state, their physical health afterwards, media's presentation of lobotomies, lack of consent for the procedures they were doing, and antipsychotics causing the downfall of lobotomies.
What are lobotomies, you ask? Lobotomies originated in the 1930s, but didn't gain popularity until 1940 to 1950. Lobotomies were used to treat severe mental illnesses or to correct behavioral issues. To do this procedure, they would sever the connection between the frontal lobe and the rest of the brain. This was done using a tool called a leucotome, which was a sharp prong that they inserted through the eye socket, or in some cases through a small incision on the forehead.
Okay, how media presented lobotomies. Early on, media presented lobotomies as some kind of like miracle cure. They weren't really discussing the risks, they were really downplaying them, and overall, they were framing them as a positive experience for people to get better. Further into it, they really actually started to cover how bad they were, and that started spreading around. People were talking about it. And after people started realizing the cognitive damage it was causing, the personality changes, and even death became more relevant.
Most lobotomies were given without consent. This was because there were no laws that required consent for procedures such as lobotomies. Walter Freeman actually used patients' resistance as proof that they needed the procedure done.
Okay, so how lobotomies affected children. They severely affected their cognitive, emotional, and social development. So they basically wouldn't mentally mature after. They still would physically, but their head was kind of stuck where it was. And they were stuck in that infantile state. They were typically used to treat hyperactivity and disobedience, which those symptoms were especially prevalent in kids with ADHD and ADD. In the picture we have over here on the side, this kid had schizophrenia. He was only 8 years old when he received his lobotomy, which is incredibly sad.
For teen lobotomies, it actually caused many issues like apathy or a loss of personality. Lobotomies would make teens very docile and passive, or leave them in a vegetative state. They would become emotionless, completely losing their spark in life. Commonly, lobotomies would be done for behavioral issues or even homosexuality. One preteen named Howard Doley, which you actually see over here in this picture, said that post lobotomy he felt like a zombie. He had a lively personality beforehand and now is completely muted. He was 12 years old at the time of his lobotomy.
The effects that lobotomies had on adults were incredibly similar to what they were with teens. Same thing with elderlies as well. They just felt really apathetic. They became very emotionless. They started to have seizures in some cases. They exhibited aggressive behaviors. They formed epilepsy. They also had issues with nausea and headaches, and in some cases, they became socially inappropriate towards others. In the worst cases, however, it would lead to death or put them in a vegetative state. Same thing with the teens as well.
Okay, so in this slide, we're actually going to be discussing physical health. To start with our next topic, we're actually going to talk about how lobotomies took a toll on the patient's physical health. It is noted that the brain's ability to compensate for damage has its limits, actually, and some functions may be permanently altered or lost. It's a sobering reminder of the irreversible nature and damage that lobotomies cause and the importance of understanding how various interventions affects the brain. Okay, so we're also going to be talking about life post-lobotomy. The first symptoms that lobotomized people manifested were normally stupor, confusional state, and urinary problems such as incontinence. With a clear loss of sphincter control, along with this, there were altercations in eating behaviors, manifesting on an increase in appetite to such a point that a lot of weight was gained after the operation. As most people know, personality in lobotomized patients was also greatly affected. They became less spontaneous, took care of themselves less, and developed a lower degree of self control. Patients no longer had the ability to take initiative. They found significantly less pleasure in life. Along with that, anterior was also a common side effect.
Okay, and then for the infantile-like state, most patients recessed back to an infantile state post-lobotomy. For children, they got stuck where they were, for lack of better words. They didn't mature any further. Adults recessed backwards as if, they went back in time to be a kid again, where they really weren't fully there mentally. And Walter Freeman referred to this as a surgically induced childhood. Now, he believed that this was only temporary and that patients would mature after their operative, with their operative care, and that this wouldn't last and it was part of the healing process. And after a while, their brains would go back to normal, but however, this never happened. Antipsychotics is what ultimately led to the downfall of lobotomies. They were introduced mid 1950s, which began the decline of lobotomies. With these new medications, they provided a much more effective and ethical way to treat medical conditions as compared to lobotomies.
Okay. And now today we're going to be talking about the future directions and understanding and treating severe mental illnesses. They're likely to focus on even more precise and personalized approaches, from targeted gene therapies to advanced brain-computer interfaces. Possibilities are both exciting and daunting. Gene therapies actually are blood tests that they do nowadays. They actually tell you a bunch of genetics about yourself, what medications you can do. If you are smoking or don't smoke, they can tell you like the differences those can even cause for you. And we're also seeing a growing interest in a non-invasive technique that can modulate the brain functions without causing permanent structural changes. Technique like transcranial magnetic stimulation, which is TMS, and neurofeedback after promising alternatives to more invasive procedures. In conclusion, we're actually talking about lobotomies and how you guys feel about them. Sam, how do you feel about that?
Get out. I think they were really bad. I think that it's really awful that they thought it was fine to do that on children and completely cognitively mess them up and emotionally mess them up for the rest of their lives. Not saying it's okay on adults, but children didn't even have
To
time to.
consent or even time to think about it?
I mean, most people didn't consent at all,
No.
but children especially, it's like they don't know what they want. And I think it's awful that they didn't get to really actually live their lives like, elderly would have, and, stuff like that. They didn't get to experience anything at all
They didn't get to experience
before
like
they basically got
teenhoods or
their,
anything like that
yeah,
either.
before they basically got their
Yeah.
brains shut off. I think that's really crappy. That 8-year-old actually broke my heart. I almost didn't put it in the slide because it
And
it
then
definitely
that
was upsetting.
12-year-old too, like that was awful. I hated that.
Now he had
Like
an interview. I think he's still slightly he's there enough to,
at least talk
know,
and
but
know things.
emotionally
Yeah.
he said he's like completely gone, which is really upsetting.
hmm
Um,
And how pretty much putting him in like a vegetable type state or like a zombie type state. Like
yeah,
that was horrible.
and he said that his spark is like completely gone in life. Um, and I feel like a lot of the procedures they did afterwards to try and help lobotomized patients, like the brain shocking and stuff, that I feel like definitely made it a lot worse because then their head is gone and it's being shocked and tortured and,
Completely
you
fried,
know,
so they can't even think at all
yeah,
afterwards, and they don't even really have a life to live.
no. I mean, they didn't after lobotomy anyways, but after the brain shock therapy
There
too,
was
that,
no way for them to even try to even have a way to come back.
yep. And then the lack of consent. Most patients that got lobotomies didn't consent at all. It was either,
Even in some
um,
cases, like families didn't even have
yeah,
the right to
I
consent.
was gonna say families either consented for them or they were just taken anyways because there wasn't a law preventing them from doing so. And most patients that got lobotomies were actually women as well. And I think that has a lot to do with monthly faces and stuff like that, where they deemed them unstable.
And then, like, the gay people, especially, like, they even didn't have a way to consent or even, like, talk about their feelings or their choices in life or even get to make their own choices on who they wanted to be with or who they wanted to be without actually having to get those done.
And some of the before and after pictures were actually swapped. So their before picture was actually the after, where they look, happier and better and stuff, and the before where they look all gone and sad and depressed was actually the aftermath of how they were post lobotomy. I
Because
don't
they
know
were
if you knew
trying to
that.
actually have the statistics and actual proof of everything that they were doing to actually keep it covered up and under wraps so Dr. Freeman can actually continue his work and not actually say how everything was going so he can keep continuing to do lobotomies on people and raising his numbers even more.
I think personally the part where he said that them resisting was actually signs that they needed a lobotomy. I thought that was insane and
Horrible.
disgusting.
Yes.
Yeah, like that
Awful.
was mm, no, that I think that
That
actually
rubbed
was
me the wrong way,
probably, yeah, that was actually probably
honestly.
like one of the worst parts about it was, him using that as
An
leverage to
excuse to do
give
it.
more
Yes.
lobotomies. That,
Yeah.
yeah, that disgusted me
Because, I
so
mean,
bad.
that's completely taking everyone's choices away from themselves, like their family's choices away, even if they don't want them to have it done either. And I mean, that completely ruins the rest of their entire lives. Doesn't even give them the free will to make choices even after that because they don't know from right or wrong, really. I
Yeah,
mean, they can't even decide for themselves on what they're doing. It's awful.
yeah. And not to even mention, which I mean, I guess that's how most procedures were back then anyways, but the lack of a sterile environment. I think it was probably, I believe it was the picture for adults, how
Yes.
lobotomies affected adults. In that picture, there's no gloves, no nothing, just
The
straight
outfits
in,
were
and
not
they,
even sterilized or anything
yeah,
like that. Who knows even how clean they were after they have even done it on other people.
yeah,
And
and the amount of people that died from infections
yes,
after,
I was gonna say that,
yeah,
like, the amount of people that end up with infections afterwards, or even probably die from them, or even ended up septic. And I mean, the lack of medications that were even done, like, out there back then, like, there was no getting better from that. They either had to suffer or pretty much die quickly
yeah.
from that.
And then I'm still thinking about that little boy, the little 8-year-old, like that. I'm telling you, when I say that broke my heart, like I mean it,
Mm-hmm.
like wholeheartedly. He was schizophrenic, so that's why he got his lobotomy is because he was schizophrenic. And the last note in the news article said that he's not violent anymore, and that before his lobotomy, they were locking him in the basement in a cage.
Not even know all that. I didn't even,
Yeah,
I completely have missed that
I
part.
know, yeah, because
Oh,
it's the one that I chose, and I was like, no, this
uh-huh.
is like really depressing.
Yeah, because the one
But
I had picked was the Howard Dooley kid. And, like, that,
yeah.
like, utterly upset my life because of the way, like, he was 12 years old, like,
Yeah,
and he's pretty much never going to outgrow that age right there. And, like, this, no, I can't.
yeah.
It's horrible.
It's yeah. I can't believe they locked him in a cage in the basement. It's like no wonder I'm sorry, if somebody locked me in a cage in a basement, I'd
I'd
be
be
aggressive
aggressive
too.
too. Yes.
Like that's insane. And then the fact they're like not aggressive anymore. Yeah, I'm sure he doesn't feel anything
Yeah,
anymore.
I
I'm sure he doesn't
mean,
feel happiness, he doesn't feel sadness, he doesn't feel aggression, he doesn't feel anger, he doesn't
obviously
feel
not, because I mean, he's in a pretty much a
nothing.
stupor state. Like, it's
Like
completely
he's
just
gone.
kept him there. Like,
Oh, and there's another case. I don't think I put that in the presentation, but there's a case where a mother said, no consent, obviously. She didn't want her daughter to
of
be taken
course,
away.
no.
I do think she was like late teen or early adult. And she said, like, my daughter's not there anymore. Like that's not that
Oh,
person that came
yeah,
back
I
is not
remember
my
talking
daughter.
about that one.
Yeah,
Yeah,
like she's completely gone.
she's
She's a
completely
shell of
different
what she
from who she
used
used
to
to be.
be.
Yeah.
Yeah, like that. I mean, imagine being a mother and having your kid taken away. I mean, no matter what age, it's your kid taken away,
Yeah.
and having them come back a completely
Completely different
different
person.
person, and you know that person's never coming back.
Hmm.
Like that's
Or even if he
insane.
lied to her and tried to tell her that she would, obviously, of course she never did, and that's obviously going to break her mother's heart and like
Well, and a
give
mother
her false hope
knows.
as well. Even if she thought by any means that obviously her kid would be back to normal eventually.
Yeah,
Like,
and
no.
holding on to that hope for your whole life too.
Yeah.
Like that's
That's like
heartbreaking.
heartbreaking and sad,
That
especially when
yeah,
you eventually accept that, like that internalizing on that sinking in feeling. It's awful.
yeah. But in conclusion,
Hmm.
I'm glad they found better substitutes. I'm glad that this isn't something that people are doing anymore. I'm glad it's not legal
And imagine,
because
like,
I'm sure
even
people
at the
would
time
still
they were
try and
still
do it under
doing this, like, how
wraps.
many people had to suffer through that, especially, like, knowing that even some of our family members could have had that done back
Yeah.
then, like during that time when it was
I
going
feel like I
on.
could have had that done back then. Like,
Okay, but same actually.
wholeheartedly. I mean, that's not even like a joke. Like, genuinely, I feel like a
For a
lot of
lot
people
of
don't
cases,
realize
really, they
that.
can
Yeah,
actually have that done still today if it was going on.
yeah,
Like there's
wholeheartedly.
so many things that people struggle with nowadays, like that back then they would have actually forced you to get it done for.
Yep. Which is insane. I couldn't even imagine. I couldn't imagine having a family member have that done because you'd never be they'd never be the same. Like you'd never get to really talk to them again. You could talk to them, but they wouldn't be there. You know what I
Imagine the
mean?
amount of toddlers who honestly I didn't even really look into that because I couldn't, but the amount of toddlers have like who've gotten sick and like were so sick that they probably forced them to even have that done and like they never even got to outlive that life.
Yeah. But I think that's all.
I think that covers it. Yeah.
Thanks for listening to us. Yeah, I feel like we're in a TED Talk or a podcast. That's
Same.
all.
But thank you guys. Then give us your feedback whether
Yeah.
you agree that this should have been done at all or if you're happy that it's over with. Thanks.